While continuing epidemiology, we will discuss this session according to following learning objectives. We will discuss bias. We will discuss various types of bias. We will define bias. And then, what is web of causation? What is endemic, epidemic, its types, and pandemic? In the end, we will summarize the session. Let's start with bias. What is bias? Bias is an error. It's a systemic error. So we can define bias as a systemic error. It will affect the outcome of the study. When it arises, it can arise at any stage or at any step of study. A study has multiple steps. At any step, bias can arise and can affect the outcome of the study. So, there are many types of bias like selection bias. As the name indicates, it arises during selection of subjects. Then, analysis bias. It can arise during analysis. Then, confounding bias. Then there is Parkinsonian bias. Parkinsonian bias was invented by Dr. Joseph Parkinsonian. Then there is recall bias. There may be interpretation bias. So, while selection bias, what is selection bias? Before conducting a study, we select certain subjects or we take a sample. When we take inappropriate sample, it may arise like in case control study. If we are selecting cases of lung cancer and we select inappropriate cases or cases of different time period, selection bias may arise. So it is arise during selection. Then, what is recall bias? Recall bias is also called memory bias. When we select cases of chronic diseases, these are old people. There is loss of memory in them. So there is difficulty in recalling the previous events. Like you ask, when you started smoking, when first signs and symptoms appear, when cough start. So there may be difficulty in recalling. It will arise. Then there is Parkinsonian bias. Cases are selected from different hospitals. Our source of selection of cases is different. Source of selection of data is different. Dr. Joseph Bergensonian said that bias or error may arise while selecting cases from different hospitals. So cases are selected from different places. Diagnostic criteria of different hospitals may vary. Admission criteria of different hospitals is different. So this can arise. Then there is confounding bias. What is confounding? Confounder is a factor or confusing factor. What it can do? It can affect the outcome. Outcome of study, like hilly area is a confounder in goiter. Hilly area, goiter is common, but it is due to iodine deficiency. Or age may be a confounder in case control study. Gender may be a confounder in case control study. So it arises in case control study, or it is common in case control study. Then there is analysis bias. Why?